Hello, my name is Dan Sitar. I'm with the Clinical Pharmacology section and the Faculty of Medicine, and I was addressing issues regarding pain management in a complicated patient in today's session. The major points that I wish to leave you with are that oftentimes we don't use enough medication for pain. For example, acetaminophen in an adult should never receive less than 500 milligrams. That pain management should be by the clock and not when pain recurs, so that there's not reinforcement of the pain issue. The other important point is that caffeine acts to improve pain management, and so caffeine can be used together with acetaminophen to prevent moving to opioid pain management, which causes its own degree of side effects. The other point is that the other over-the-counter medications that can be used with acetaminophen include ASA, ibuprofen, and naproxen. Those three drugs should never be used together by themselves, but either of those drugs can be used together with acetaminophen, and again together with caffeine to improve pain management before you move to considering opioid drugs. The amount of caffeine that's required to improve pain management is equivalent to 60 to 120 milligrams, or 1 to 2 cups of coffee equivalent per dose. And so the caffeine would be administered every 6 to 8 hours along with the pain medication. It should never be administered as hot coffee because that slows down stomach emptying and reduces the rate of onset of the analgesia. Analgesia is best implemented by taking your pain medication with a glass of cold water so that your stomach empties quickly, and that you do not lie down for an hour to 2 hours after you take your medication to allow the drug to be absorbed as quickly as possible. If you are taking other medications for other diseases that are present at the same time, it is very important that you discuss with your healthcare provider the implications of drug interactions between your analgesic and the other drugs you're taking. Especially true with codeine-containing medications, because the codeine has to be converted to morphine in order to be effective as a pain relief drug, and that a lot of the drugs that are taken for chronic diseases will block the ability of codeine to be converted to morphine. Having said those things, adequate trials of analgesia oftentimes will reduce the need to use antipsychotic medication, because in a patient who is cognitively impaired, often they are unable to provide you with feedback considering the fact that their discomfort is related to pain and not to what you perceive to be further complications of their dementia. That will provide relief to the patient oftentimes without increasing the risk of the comorbidities that occur when you apply antipsychotic medication to the patient with mental impairment. Thank you very much.